Hello everyone, this is Ryan Napolitano with the Lexer Lab Group. Today we're talking about what to include with an implant case when you're going to send it into the laboratory. First and foremost, we're looking for a prescription. Some basic case information, type of restoration, shade, some enclosures with the case, and any other pertinent details that you may want to include. Some of the important enclosures with these cases would be the surgical report, a digital image of the radiograph, and the impression coping included in with the restoration. When we're sending in impressions, one of the important elements here is to look at the stability of the impression coping. Now we do need the impression coping and the retaining screw for that impression coping. So if this happens to be a closed tray impression, you can see here that this is a Zimmer. And we do have the impression coping body as well as the silver retaining screw as well. Now when we're evaluating these impressions, one of the things that we're looking for is any movement of that impression coping to make sure that it is secure and well seated in the impression. Also nice to have with this case is a set of radiographs. So here you can see with this implant we have a radiograph of the healing cap in place and another radiograph with the impression coping in place. Now the impression coping in place is an important one. This allows us to see that this is in fact seated on the implant. Now some of you will note that there is a dark area of radiolucency between the impression coping and the implant. With a Zimmer TSV, this is actually what we normally see here. The important area to look at is the wall of the implant and how that attaches to the impression coping. So you can see that we're perfectly sealed on both the mesial and distal here. This internal gap is actually something that is common. You will see this in your radiographs. Don't let it throw you off. This allows us to look at any bone issues that we may have when we're looking at this from an emergence profile. Now you can see over here that we do have a very, very high level of bone, and this tells me that we do have to watch the emergence profile of the abutment when we create the restoration, because if we flare this out too much, we may in fact impinge on this hard tissue area here, creating a restoration that is difficult, if not impossible, to seat chairside. So it's important that we see these radiographs so we can see exactly what we're looking at from a standpoint of soft and hard tissue. Also included with this case, we do have a surgical report from the surgeon, the specialist. They were nice enough to outline exactly what's here. The important part of this for the laboratory is that we are able to confirm all of the pertinent details of the implant to make sure that we are providing you with the correct componentry. Once that's done, obviously with a opposing model and a bite, we can then create our master cast and work on creating our restorations. As always, thanks for watching, and please feel free to reach out to us here at the laboratory if you do have any questions or concerns.